Afternoon, Hattiesburg. Thanks for joining us for this Thursday afternoon briefing. I know our conversations about COVID-19 have been slightly different this week, and there are a number of factors that go into that, including it's been kind of an irregular week at City Hall. We also have had some days where the Department of Health has had a few technical glitches, such as today, and we try to make sure that we know your time is valuable. We try to make sure that we get you the information that's accurate and it's pertinent and current. And so let's jump right into it. We're going to go over today's numbers. We're going to talk about some ICU demographic numbers as well as some shifts and symptoms that doctors are seeing on the ground. We'll talk about Governor Reeves' safe return order being extended. Just a word about personal responsibility, some availability of masks, the application period now open for Back to Business Mississippi grant program, and of course our regular act of courage. Today's numbers, these are system-wide numbers for Forest General, Merit Health, Wesley, Hattiesburg Clinic, and Semrai. As of this morning, 17,107 tests for COVID have been conducted. 1,654 of those have come back positive. Of course, those are not all Forest or Lamar counties. 14,774 have come back negative. We have 679 tests that are pending currently. One item of concern for us is the number of hospitalized patients. 48 people between Merit Health, Wesley, and Forest General are in the hospital right now. That's 8 over the average for the last 14 days. In the ICU, that number has grown to 17, which is also over the average for the last 14 days. And last week that number had kind of fallen off, and we saw a really big spike over the weekend and into this week. And so for the last 2 out of the last 3 days, we've had more people in the hospital than we've had since COVID-19 hit our community back in mid-March. This is obviously concerning because if people have adverse reactions, they go to the hospital. Those are the kind of patients who end up in the ICU. And so while our ICU numbers are staying under 20, that number of hospitalized patients points to some potential bad news as we look at the ICU number in the coming days. Just some ICU profiles. As of yesterday, the average age of those were 59.9. Those came from 9 different counties, but I will say that Forest County had the plurality of those. So 8 of the 20 did come from Forest County. We did have 2 new deaths in Forest County as well on the 8th and the 10th, and we send our sympathies and well wishes to those families. So far in June, we've had 3 deaths, which brings the total death toll in Forest County to 41. Totals per county through June 10th. This is actually through yesterday, and what we received word this morning is the Department of Health had a technical malfunction, and they were not going to be able to send out testing numbers today. We may get some tonight. If not, we'll get them in the morning. But these are actually totals per county as of yesterday. Yesterday, Forest County added 18 new cases. Lamar County added 6. And so Forest County's total to date is 667. Lamar County's is 278, which brings the metro area getting closer to 1,000. However, those are not all active cases. We look at active cases. We look at the number. Well, before we do that, we have the 5-day average. This kind of gives you an idea of where the trends are headed. It takes the number of new positive cases and averages it with new positives the 2 previous days and the 2 days following. And so you see we got down kind of, that number dropped significantly toward the end of last week, but over the weekend we did start to see that rise, and that number has continued. Not peaking where we were in mid-May, but still nonetheless concerning in terms of a trend. So in terms of active cases, we look at the number of people diagnosed in the last 14 days. Typically, unless there's an adverse reaction, COVID usually clears up within 14 days or less. And so those who have tested positive in the last 14 days, that's a very general estimate on the number of potentially active cases that we know about in our community, because these folks are generally infectious. These are the folks that are isolating, and then the number outside 14 days, of course, factoring in the number of deaths that we've had, are generally a basic estimate on who has recovered or who has survived COVID. And so 156 in Forest County. In Lamar County, that number is at 51, with the number of survived or recovered around 216. And this is kind of how that trend, that inside 14-day number has gone. So after hitting kind of a really high mark toward the middle 3rd week of May, the numbers continue to fall. However, we're going back up again. If we can keep the number of active cases around 150 or fewer in Lamar County, 50 or fewer, then that's something I think that we can manage and our hospitals can manage. Because look at our goals. We want to protect vulnerable populations, because those are the folks, if they get COVID, people over 60, people with underlying health conditions, they're more likely to have an adverse reaction and end up in the hospital, which goes to our second goal, preventing overrun of the healthcare system by slowing the spread. And what we want to do is prioritize public health while giving the private sector the space it needs to reopen. And our 4 factors, the widespread availability of testing, the wearing of masks, the watching our own data, which we just showed you, and listening to all voices, all those things kind of push us forward as we head into our hopeful recovery from this. One thing that we're seeing on the ground that just want to let you know in case you or someone you know has this. In March and April, typically the symptoms we saw were high fever. That was the bulk of the cases. In May and June, that started to shift. We're seeing fewer number of fevers and more people coming in with a loss of smell or taste. And so I don't know, the seasons there's a lot of theories on why that happens, but when we first started, the loss of smell and taste was not a symptom that we had heard about. It was cough, trouble breathing, fever. And now that sense of smell and taste tend to be the prevailing symptom that people are having when they come in to get tested. So keep that in mind. If that happens to you, you may want to go seek an opportunity to get tested. Of course, yesterday, Governor Reeves extended his safe return order, which was slated to expire on the 15th. Now it's going to expire on the 29th. Most of those things stay the same. The only thing that's different is the 10 p.m. closing time is lifted for restaurants and bars that serve alcohol. Of course, all of the CDC and sanitization guidelines remain. All of the screening questions that they are supposed to be asking customers, those things are still left in place, and we definitely need them doing that. Outdoor and indoor arenas can open to 25%. If they have a concession stands, those remain closed. If they have restaurants or other seated food service, they have to operate under the restaurant guidelines. And here's just a word on personal responsibility. I know that the state is continuing to lift restrictions and people are getting back out. We're also seeing kind of a real spike in many counties. We haven't hit our peak yet in terms of trying to pass what happened in mid-May, but as things start to open back up, please keep in mind that you are safer with a mask on when you get out. Please keep in mind where you go, who you interact with, and then who you're potentially exposing by bringing that home. If you have people with compromised immune systems, if you are caring for elderly parents or grandparents or even young children, I mean, you need to think about kind of what you're doing, and is that the safest thing not only for yourself, but the people around you. And so government cannot keep this thing locked down, nor should it until this is over with. We really just need people making good individual decisions. Speaking of masks, we have a shipment of masks that have come into our EOC. These are actually washable masks. They will be available at all of the Hattiesburg fire stations Friday and Saturday of this week, and the Forest County Emergency Management Office at 4080 Highway 11 will have them as well. We encourage you to stop by and pick up one or more if you need it for your family and yourself. Also want to let you know that we've talked about the Back to Business Mississippi. These are the up to $25,000 in grants for small businesses with 50 or fewer employees. That application has gone live today, and so if you go to backtobusinessms.org, you can see all the eligibility requirements and you can submit an application there. There are some tight timelines, and the amount of money available is limited. So I encourage you, if you know someone with a business with 50 or fewer employees, encourage them to go and apply for this grant. And our act of courage, I want to thank all of you who gave blood last weekend. During COVID-19, blood supply has diminished. People are often afraid to get out into settings to give blood. Thank you to the 127 people who came to Jackie Dole last Friday and Saturday to donate. You made a real difference, and we're going to continue for people to come forward and get with Vitalant and donate blood. And so as we go into Friday, aside from making good decisions and exercising personal responsibility, remember to wash your hands, take care of yourself mentally and physically. Please wear a mask if you go out in public. Do only what is essential, and remember, you're always safer at home. Thanks. Have a great day.